Welcome back to Less Than 3%, where we talk about my journey to becoming a physician, medicine, healthcare, and really anything else that relates to being a black male pursuing medicine. In this episode, what I want to talk about is something that's very much related to healthcare systems, especially dealing with the system of healthcare that we have in the United States. So today, we're going to ultimately talk about how does the US's healthcare system fare in comparison to some of the systems that we find in other countries. So there's a couple things I want to analyze today. One is what exactly has worked for other countries when it comes to healthcare. So we're going to get into a couple of examples. I want to look at some pros, some cons of some of these different healthcare systems as I'm kind of learning myself. And ultimately, what could maybe be taken away from this, and what do we know about how the US healthcare system can improve itself? So let's get into it. So first thing I want to mention is that this definitely connects a lot to the concept of universal healthcare, which, as defined by the World Health Organization, universal healthcare coverage means that all people have access to the full range of quality health services that they need when and where without financial hardship. And it covers a lot of different forms of care, from prevention to rehabilitation to treatment and all these different aspects of healthcare. So the first thing I want to consider is a little bit of an overview of a couple of different nations that I want to take a look at. What I'm going to bring up is Canada, Germany, and France's healthcare system. And we'll take a look at how that fares in comparison to the United States just a little bit. So to go over a little overview, I have an article published in the Materia Socio Media Journal titled Comparisons of Healthcare Systems in the United States, Germany, and Canada back in 2012. So the first thing they talk about is just Canada's insurance program and how that works. So they have a system known as Medicare, not the exact same thing as what we have in the United States that we know as Medicare. This system really began to develop immediately after World War II, actually tracing back all the way to the 1940s. And the 1984 Canada Health Act is what was used to ultimately define the exact healthcare system that it currently has. So just to go over some implications of it, what we find is that with very few exceptions, health coverage is really available to all residents and there are no out-of-pocket charges. Physicians are paid on a fee-for-service basis and they actually do have a lot of autonomy in how they practice. Private health insurance for covered services is illegal, as I'm going to mention, and all physicians are pretty much forced to participate, and every health plan effectively serves all residents in each province. So there are a couple things I do want to mention in terms of some of the results that we normally see when it comes to this type of system. One thing that it mentions is that by at least United States standards, physician incomes are actually pretty low. So in 1992, the average income of self-employed physicians was around $104,000, but this is actually 5 times the average Canadian worker, although it's less than 2/3 of that of the typical physician in the United States. Now, there is a pretty huge drawback, I would say, just off of what I've looked at even in this article and a couple of other sources. One of the main critiques that could come up in terms of this system has to do with waiting times. So waiting lists when it comes to surgical diagnostic procedures are pretty common, and this paper goes on to mention that the average wait for treatment is about 13.3 weeks. So that's quite a while. As they go even further, they mention average waiting time in over 80% of procedures is about 1/3 longer than Canadian physicians even would consider to be reasonable. So those delays can be a pretty significant issue. Moving a little bit forward, they take some time to also mention that there are some clear benefits when it comes to this, as although there can be critics of the Canadian system, most Canadians seem to support this version of Medicare. Now I want to keep moving. I want to go to Germany, as they also touch some things in Germany and ultimately with the United States. So in Germany, their model is a little bit different. It's often known as the Bismarck model. So taking a little bit of a look at history, in 1883, you had the Sickness Insurance Act, which was passed. And so this became the first social insurance program that was organized on an entire national level in Germany. So this article mentions that over the last 130 years, the system has really grown to a point where pretty much the entire population has access to medical care. And now, in this system, individuals are required by law to have health insurance. People who earn less than $15,000 have to join one of the sickness funds. These funds are private, non-profit insurance companies, and they will collect premiums from employees and employers. And the article also goes on to mention that payment for these specific funds will represent pretty much about 70% of all the healthcare spending that happens in Germany. Now, there's a set of benefits that these sickness funds are to come with. So, for example, there's ambulatory care from physicians, nursing home care, preventative services, all types of services related to these. So it has some small similarities, as I actually mentioned, which is that, so for instance, larger numbers of employee groups and independent insurers and providers will often reach agreements without direct government intervention. So lastly, talking about the United States, we don't have a single nationwide system specifically. And what we find is about 84% of the population has either public or private health insurance, vast majority private health insurance. And there are a couple insurance plans to consider. So one thing known as managed care associations, or MCOs, are systems that, as defined in this article, integrate the financing, delivery, and appropriate healthcare services to covered individuals by means of agreeing arrangements with selected providers, very explicit criteria for selection of healthcare providers, financial incentives for members to actually use these providers, and the procedures that go with these plans. So there are two types of MCOs. There's HMOs, health maintenance organizations, and PPOs, preferred provider organizations. So about 70% of employees have MCOs. Now, in terms of public health insurance, what we have are two systems known as Medicare and Medicaid. Medicare is a public health insurance program for aged and disabled individuals. It consists of two parts. Part A, which provides coverage for inpatient hospital care with a little bit of nursing home services and home health services. Part B, the supplemental plan, will provide benefits for physician services, outpatient hospital services, outpatient services, and things of that sort. The second type, Medicaid, provides coverage for economically disadvantaged groups. It's financed by the federal and state governments, and it's administered by each state. Medicaid covers about 12% of the population, but there is a third category that definitely has to be considered when talking about U.S. healthcare, and that's the uninsured. So this article mentions that 16% of the population is estimated to lack health insurance coverage at any point in time. And even though there's often healthcare services that are able to get out to the uninsured, the lack of health insurance can create a lot of long-term issues dealing with financial hardship and insecurity. And one of the main issues that can come out of this is the fact that uninsured people would more likely end up having to receive their care from the ER, where it's already pretty late in terms of receiving treatment. So after getting into a little overview, I want to take a moment to just list off a couple of pros and cons that I found pretty helpful in terms of some of these systems. I want to take a look at two papers that were put together by Louise Gale dealing with Canadian and German healthcare pros and cons. So first, just to look at the Canadian Medicare. Some of the pros that it'll mention is that it has a very straightforward system of care. It's provided to all Canadians. It's a very inclusive primary healthcare system. And of course, making sure to get primary care to as many as possible is extremely important. Okay. Canadian doctors might earn less, but they will have less overhead costs that they really have to worry about, and typically better working conditions. And there is a lot less student debt for doctors who are in the Canadian Medicare system. So that's definitely a major plus for the Canadian Medicare system. However, there are some cons that she brings up. For instance, as mentioned earlier, there can be very long wait times for non-emergency procedures. And this actually brings up a 2017 report that mentions that the median waiting time for seeing a specialist physician is about 21.2 weeks, just between referral and treatment. And I think if there's such a huge gap, that could definitely have some very detrimental effects when it comes to just public health in general and ultimately long-term health and being able to treat conditions that need to be taken care of. It's a healthcare system that tends to be a lot more reactive as opposed to proactive. And that can also be a pretty serious negative, considering that you're ultimately going to want to have preventative care as a priority as opposed to reactionary care where things might already start to get pretty late and certain chronic health conditions can maybe start to flare up a lot more. Now, moving on to Germany's healthcare system, I want to mention a couple of pros and cons with that, with another paper written by Louise Gale. So one plus that's mentioned is that there are a lot fewer prescription dependency issues in Germany. So because they have more of a wait-and-see approach when it comes to treatment, there's less people taking medications such as opioids to control pain and things like that, and so that can lead to less abuse of drugs. Some other pros that get mentioned is that you can always really expect to receive high-quality care, and Germany has some pretty strict anti-corruption laws, so that can definitely help for a very honest and beneficial healthcare system as a whole. Now, there are some negatives I also mentioned. For instance, doctors don't make a lot of money in this healthcare system, similar to what we mentioned with the Canadian Medicare system, as although the salary is pretty decent for Germany, it's definitely a lot less than you'd make in the US. Medication is given less freely, so that's a bit of a drawback when it comes to prescription medication, and some people still can't afford public health care costs. So one more thing I want to touch on would be ultimately when looking at these different nations and then taking a look at our own healthcare system, what could potentially be improved? So the first thing I probably want to bring up is something that I found from a Harvard Business Review article written by Mark Harrison, talking about 5 critical priorities for the U.S. healthcare system. And I think this would be a pretty good place to start in just considering what were the other priorities. And a couple of things that they mentioned that I think are definitely very key. Number one is definitely improving health in terms of chronic conditions. As they mentioned, a statistic from the CDC that mentions that 6 out of 10 Americans have at least one chronic disease. Another thing, as we've talked about quite a bit on the podcast, is racial disparities and being able to tackle those. And there was a third thing that definitely caught my attention, which is expanding telehealth services. So basically what this would entail is, as I mentioned, becoming more consumer-centric, as it would be getting to care for people even closer to their homes. And I think that can definitely have some great impact, not just in terms of physical health, but definitely emotional health, mental health, and a lot of other areas such as those. Now, with all things considered, I definitely think there are some takeaways that can come from all of this. I would say that this definitely ties directly into considering what exactly would work best when it comes to U.S. healthcare system. I definitely think one of the things that has definitely come to my mind quite a bit would be that we definitely have to consider that there can be differences between different countries for sure, and that what works for one country may not work for another country based off of probably a number of factors, whether that would include maybe the culture within that country, maybe the workforce, and just things of that sort. Now, I would say just off of these things, there would definitely be a lot more I'd probably want to learn in terms of how a lot of these different healthcare systems work and function and some of the different factors that influence them before I'd probably be able to figure out what exactly we would be missing in comparison to other countries. And definitely being in a country where we spend quite a lot when it comes to our healthcare spending, but don't necessarily get as great of results, these are definitely things that have to be considered. So I hope you learned a lot from this episode, and let's see what we talk about in the next one.